Hey guys, Lori here, pharmacist. All right, so this is video 3 in the series about what's going on with our healthcare, or our sick care, shall we call it, or maybe our joke care. So let's dive in and look at a few more statistics that I didn't go over the other day in the effort to keep, it under a certain amount of time. All right, so we learned that children specifically are not well. We learned that asthma, 1 in 8 children, allergic eczema, 1 in 5, hay fever, 2 to 3 out of 5 children, food allergies, 1 in 12. Then we have the neurological disorders, of course, like 1 in 6 children has a mental health disorder. 1 in 36 children is now diagnosed as autistic. And I have to tell you that boys are 4 times more likely to be diagnosed with autism than girls. ADHD, 1 in 10. Learning disabilities, 1 in 6. And then there's a few more that I read off, but those are the main ones. So suffice it to say the children are pretty sick. And it has not always been thus, okay? If you look at the autism rate, back in 1980, we were at about 1 in 10,000. In 2002, we were at about 1 in 250. In 2008, we were at 1 in 88. At 2013, we were at 1 in 50. And now 2017, 2018, it's 1 in 36 is what they're saying. Do you know that 1 in 10,000, I did do that math, up to 1 in 36 is over a 27,000, almost a 28,000% increase. The interesting thing with autism is some people say, there's the genetic theory. Well, it's genetic. My problem with that is that how many autistic children do you know of whose parents are autistic or whose grandparents are autistic? Furthermore, there is no genetic disease that I know of, and maybe you all do. I'm just saying that I know of in my travels, in my studies, looking at this whole autism thing, that has a 28,000% increase. That is not genetic. It's impossible to have a genetic increase of that magnitude. So, what's going on? What's really going on here, people? And you want to say, well, it's environmental. It's the air, it's the food, it's this, it's the that. The problem is, it's the children that are being diagnosed. When I was doing medication therapy management, talking to people all over the U.S., ages 40 to 90 range, you know how many people I ever talk to when I'm talking to 15, 20 people a day on average, 5 days a week? Do you know how many I talked to that said, it's the damnedest thing. I've got all these diseases. I'm diabetic, high blood pressure, maybe asthma, COPD, heart failure. One of those 5 things qualified them for our services. And then, of course, we counseled them on their whole drug therapy based on that. Anyway, not one ever said to me, I've been diagnosed with autism. So I think it's safe to say there's something else going on. The question is, what is it? And I think if we as healthcare professionals continue to just sit here and go, I don't know, it's a real disservice to the people that we are servants to, that we are advocates for. All right, so autism, got off on that bunny trail. What else? Let's cover a few more things about the children. Asthma in children on the rise. Again, I was practicing pharmacy in the early 90s, began working in a pharmacy in the early 80s. I'm telling you, that albuterol inhalant solution was not flying out the door in the 80s and the 90s like it is today, okay? There's just no comparison, not to mention the antibiotics kids are on. So anyway, the American Lung Association states that asthma is the most prevalent chronic condition among children. That's comforting. The Centers for Disease Control and Prevention reported that between the years of 2001 and 2011, the incidence of asthma increased by 25%. That's a pretty darn hefty increase. According to the CDC, the greatest rise in asthma rates was among Black children. Almost a 50% increase in Black children from 2001 to 2009. There are several theories as why the rates of asthma are increasing. We've got the hygiene hypothesis. I'm not going to read through all of these. You can just imagine what that is. We've got medications. There's studies that the link of certain medications to the uptick of asthma. For example, the use of excessive antibiotics, which can alter gut flora, could perhaps lead to developing increased chronic conditions. Well, I think the bigger question is, okay, medications, we can go there, but why are the children being prescribed so many more antibiotics than they used to be? All right, what's gone wrong there? Then we've got obesity, okay, vitamin D deficiency. Well, children are inside playing video games instead of outside getting sun, so I could see where but that's pretty easily remedied. Obesity, actually, it could be if we were a little more disciplined here in America. I'm not really sure what's going on with the kids and the obesity thing, but then the real answer, no one really knows. Kind of like autism. We don't know. We don't know. We're one of the most developed countries, but we don't know. Everybody's getting sicker, the children and the adults too. Oh, and I can't... This will not be complete without discussing SIDS. Yes, sudden infant death syndrome. When it comes to the US of A, long story, we suck. Okay, we suck. Out of 36 other countries that are based on like the economic scale, at 36 other countries, we rank 33. In other words, there's 32 other countries you could live in and your infant is less likely to die of SIDS than the USA. Ahead of us is Mexico, not sure what's going on there, Turkey, and Chile. Those are higher than us. Everybody else, Switzerland, United Kingdom, Latvia, Portugal, Finland, all of those, you're better off there. Our kids are just sudden infant death. We don't know. Here we go again. It's another we don't know. So many we don't knows for such an advanced healthcare system, wouldn't you say? I think so. I think it's hugely problematic. And it's again why I'm saying healthcare professionals need to rise up, because we need to start using our brains. We need to start thinking out of the box and realize that what is going on in the USA is not working. Plain and simple. Let's talk about adults for a minute. Diabetes. So if you look, and I can post this chart, I came across it looking at the prevalence of diabetes, which, by the way, just like autism and asthma on that graph, when you get to diabetes, whoop, same thing. Like little under 10% of the population is now diabetic. Back in 1958, about 1% of the population was diabetic. Now, we're at, this is diabetic and pre-diabetic, no percentage with diabetes. So this graph, this is 1958 to 2015. It's saying number of diabetics is about 25 million. Now we're up to 30 million. So that's a lot of diabetes, and yet we have all these diabetic drugs. We have what? We have a joke of a healthcare system is what we have, because people are not getting well. They're getting sicker. The adults are sicker. The children are sicker. And yet the children are being diagnosed with autism. The adults, not so much autism, but diabetic, high blood pressure. 1 in 3 adults has high blood pressure. So who's making all the money in this? Well, that's not hard to figure out. The pharmaceutical industry. Remember the 750% increase that I talked about in healthcare expenditure since 1970? and the population has only increased less than 60% in all that time? Yeah. You know, a lot of people get upset with the insurance agencies. You see articles like the insurance agencies our health insurance is not picking, you know, they're not paying for procedures. They're not paying for this. They're not paying for that. They don't cover the other. I mean, you know, when you look at the profit margin of the health insurance agencies, it's not very high. It's less than 10%. It's more like about 4 or 5%. Okay. But when you look at the profit margin of pharma, they are by far the industry with the largest profit margin. You don't believe me? Read for yourself. It's there. It's like a 63% profit margin or something. It's insane. They outspend gas and oil 2 to 1. So yeah, in their lobbying in Washington, all what they pay for there. What else? Oh, I think I should wrap this up and say one other thing. So while the pharmaceutical industry is making bukus more money over the, you know, their trend financially, they're going up. Everyone else is sicker. Let's discuss list of largest pharmaceutical settlements. I'm not going to go really deep into this. This is actually just information you can find on Wikipedia. It's pretty cool. I typed in pharmaceutical industry convicted felons, and this popped up. And basically, it starts back in 2012 with GlaxoSmithKline. You've got Pfizer, Johnson & Johnson, which, by the way, I don't know if you know, but that talcum powder you used on your babies and have used for years, maybe when you got out of the shower, turns out did have asbestos in it, and they knew it. So huge lawsuit going on about that right now. But anyway, we got Johnson & Johnson, Abbott, Eli Lilly, Amgen, Merck, Purdue, Allergan, AstraZeneca. Anyway, the list goes on. The pharmaceutical industry is involved, and laws allegedly violated False Claims Act. That's like the major thing. Some of it's for kickback. Some of it's promotion, failure to disclose safety data, paying kickbacks to physician, making false and misleading statements concerning the safety of Avandia. Well, this was for GlaxoSmithKline. So yeah, off-label promotions. This is our pharmaceutical industry at work for you. Yes, sirree, Bob. And violation of the False Claims Act is a felony. So yeah, the people that are running the show in this country, running the healthcare in this country, are convicted felons, multiple times over, I might add. And we are trusting them to bring the drugs to market, to bring the vaccines to market. We are trusting their safety studies in light of the fact they're convicted felons. And we're watching everyone get more and more sick. It's just a glorious time to be alive, guys. It really is. Unless you're onto this and you've realized other ways to boost your immune system and to avoid prescription drugs, and you can actually live a healthy, happy life, which is possible, I want you to know. Take it from me, 57 years old on exactly 0 prescription drugs. And I had reversed some disease states. We'll have that conversation another day. But anyway, just wanted to bring you up to speed. I think it's important we know where we are. This video has gone a little long, but I wanted to get these statistics out of the way so we can move on to the next topic. What could possibly be the problem? What are we missing? Because it's very evident we are hugely missing something. Okay, so in order to find me, just to let you know, I'm also on Facebook as Lori Wise. And I have a Facebook page, The Wise Pharmacist. I have a website that I'm currently working on. That's thewisepharmacist.com. And you can also subscribe to me on YouTube. Because I am speaking out against our wonderful, quote unquote, healthcare, sick care, joke care system, whatever you want to call it, my YouTube channel may get wiped out when they do whatever they're doing with the revamping. If it does, I will be moving over to Brighteon. So just to let you know, again, thewisepharmacist.com or The Wise Pharmacist on Facebook. All right, Thank you guys so much. Look forward to your feedback. I'm interested in whatever you have to say, and we'll talk soon.